Welcome to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Jan Engelbrecht and I'm chatting to Dr. Clifford Yudelman from OptiSmile, and we are here once again ready to take a deep dive into the world of dental care from a consumer's perspective. So whether you're looking to brighten your smile or protect your wallet, we've got you covered with this podcast, offering you practical advice and also the latest insights. And today's episode is receding gums. Are you brushing too hard? It's actually a question I ask myself every day. Whether you're noticing sensitivity or you're concerned about your gum health, Dr. Clifford Yudelman from OptiSmile will share some essential insights to protect your gum margins. Dr. Yudelman, welcome back.
Thank you, Ian. Great to be back and great to speak to you today on this subject. We get a lot of people ask us about it. We have done some episodes on gum disease and on tooth sensitivity, but this one is specifically about brushing too hard. So looking forward to answering your questions.
I want to ask you firstly, what exactly is gum recession?
So the gum recession that we're discussing today is when the gum tissue pulls away from the tooth, exposing more of the root surface. So your enamel is the white part of the tooth, and then there's a little joint called the cemento-enamel junction. The cementum is actually the root surface. And so it often starts subtly. Most patients don't notice until they start feeling sensitivity when they stick their fingernail at the gum line and they scratch on that root surface, or they see longer looking teeth, sometimes the canines, your eye teeth, your dog teeth there, as people sometimes call them. If there's exposed roots, they're more prone to getting decay and also to abrasion. So that can lead to further dental problems. Catching it early helps us to manage it conservatively before it progresses.
So how common is over-vigorous brushing? You sometimes see people standing in front of the mirror watching themselves brush their teeth for about, I would say, 10 minutes or so.
Yeah, especially at the airport when you see people get off airplane and then use one of those hard brushes that they give you on the airplane. Yeah. So many adults believe, that harder equals cleaner. But in reality, too much force can scrape away your gum tissue. Clinical studies show a significant percentage of recession cases come from improper brushing techniques, and it's pretty widespread. Patients often damage their gums without realizing that they're brushing too hard. And once we adjust their technique, we usually recommend an extra soft toothbrush and to change it regularly. I think people buy these harder, stiff toothbrushes because they seem to last forever. Stick with a soft toothbrush.
I was going to ask you now if it actually matters whether it's hard or soft, but those hard ones are more for scrubbing the toilets, I think.
Yeah, exactly.
They're very hard. Okay, but they're affordable. I think that's probably why people buy those hard ones. But anyway, what early signs should you look for at home?
So a slight notch at the gum line or increased sensitivity when you're drinking something cold are red flags. If your gums bleed when you brush gently, then that's a sign that they're under stress and you need to be more gentle. It could be that you've got gum disease or that there's plaque buildup even though you're scrubbing really hard. So that's when you want to see the dentist and then get it clean with the dentist or the hygienist. Keep an eye out for changes in color or texture. So thin, translucent areas along the gum line can indicate that you're about to get some recession. In dental terms, we call it biotypes. You get thin biotype and thick biotype. So the thick biotype is like very fibrous gums that have got like little dimples. We call it orange peel stippling. And thin biotype is very thin, see-through, kind of reddish gums. And the thick biotype, you can't really cause too much damage if you're brushing properly. But the thin biotype, you have to be very careful because you can really mess those gums up. But if you have any questions about uneven gum levels, that's when it's time to check with your dentist. We have spoken before about other causes of recession. One of them is called an abfraction, and that's where you got like one tooth with a very deep notch, and the teeth on either side maybe don't have anything. That's usually a bite-related problem, or from clenching or grinding. That's where you're biting really hard on a tooth and you're not biting straight. So that tooth is flexing backwards and forwards, and it gets a notch at the gum line.
Ah, okay. But doctor, how much pressure is too much pressure when you brush?
A good rule of thumb is to press about as hard as you would need to flatten a tube of toothpaste, which is firm but not abrasive. You shouldn't feel any discomfort. If you feel like you're scrubbing, you must ease off immediately. Many people find that holding the brush like a pencil naturally limits the excessive force. If you are, clamping your fist around it and you've got one of those long-handled toothbrushes and you're acting like you're scrubbing the toilet. I believe in the army, they make people scrub toilets with a toothbrush as punishment. Don't do that. What's really great is a pressure sensing electric toothbrush. I use one of those. We've got some very fancy and quite expensive brushes these days that as soon as you push too hard, it actually gives you like a vibration and a red light flashes on the bottom. So those are a good investment if somebody really does have a problem and they don't know how much pressure to use.
That sounds like a nice toothbrush, but also, which toothbrush types, manual versus electric, actually help prevent damage?
Yeah, that's a great question. People ask us all the time. I often get patients who are not causing recession. They just use an over-the-counter, a soft, Oral-B or Sensodyne toothbrush, and they do a great job. They brush for the recommended 2 minutes, and they've got no plaque on their teeth, and they ask me, should I get an electric toothbrush? And I always tell them, don't waste your money. You're doing well already. And then I get patients who use an electric toothbrush. It could be a very fancy, expensive Oral-B with a little rotary head or some other toothbrush that's expensive, and the bristles on those are really soft. If you turn those off and you brush with them, it doesn't feel like they're doing anything. So it's only when they're vibrating that it feels like it's doing a great job. And then those patients have got these worn out bristles or heads on these fancy toothbrushes, because if you think the toothbrush is expensive, the replacement brushes are even more. And so they use them for 6 months or a year, and they got plaque all over their teeth. I switch them to a soft manual toothbrush immediately until they get a new head for their brush. There is no right or wrong answer there. The ones with the built-in sensors are great. I like the sonic or ultrasonic brushes because you can just buzz them along your gum line very lightly. Like I said, when they're off, the bristles are super soft, and you can get, we have even extra soft brushes for this fancy brush that I mentioned. Comes with an app. It tells you which spots you missed. It's quite phenomenal what's built in, all this AI. It actually knows where you're brushing.
Wow.
But regardless of the tool, mastering the correct technique is the key to preventing further recession.
All right, and any proper techniques or angles to follow when brushing?
Yes, different dentists have got different opinions. In general, most people recommend that you aim the bristles at a 45-degree angle towards the gum line, sort of vibrates. Pretend you're an electric toothbrush, just vibrate the toothbrush bristles around, or try to use a gentle, kind of like a circular motion, rather avoiding a horizontal scrub, like from the front to the back to the front to the back. You can do that on the tops of the teeth. You're not going to damage anything. But if you go hard front, all the way from the front to the back, like you're scrubbing a pot, that's when you're going to start causing damage. Let the brush head do the work. Guide it slowly rather than scrubbing vigorously. And for the electric brushes, which are great for this, you just simply move the head methodically along each tooth and gum junction without putting any extra force. And I always say, instead of closing your eyes and leaving the tap to run full blast and leaning over, dribbling toothpaste. Rather put less toothpaste. Look in the mirror when you're brushing. Try, if you do splash toothpaste on the mirror, do make sure you wipe it, or you're going to really irritate your husband or your wife.
Yeah, and close the tap, for heaven's sake.
Yeah, close the tap. Yeah, especially if you live in the Cape. Yeah, close the tap. I don't know what it is about leaving the tap running there. It's very common. That's another story. Yeah,
it is.
Yeah.
I think it irritates people endlessly. But anyway, any non-surgical treatments can actually reverse mild recession of your gums?
If you get a professional deep cleaning to remove plaque and tartar under the gum line, if that's a problem, that will help the gum to reattach. Desensitizing toothpaste and fluoride applications or other desensitizers can help protect exposed root surfaces that are sensitive. Toothpaste like Sensodyne and other toothpaste that have special desensitizers. We usually have a few special ones here that we recommend. Not all of them are available over the counter at pharmacies. So I'm not a big fan of mouthwashes, but sometimes we recommend something with chlorhexidine that doesn't stain. It's called Curaden or Curacept. You can only unfortunately get it from a dentist, or now I think some places have it online, even though it's supposed to be dispensed by a dentist. And that's about it. I think that's for mild recession, but if you've caused a lot of recession, then I think that leads us to your next question.
And that's when you should obviously consider a gum graft or a specialist referral. Is that right?
Yeah, so rule of thumb, if the recession is really bad, 3 millimeters or more, in certain cases, I will recommend a patient go and see a periodontist. We don't do that type of surgery here. A lot of the time, the recession has been stabilized. So we use an iTero scanner, and then we can do time lapse. So a year later, we can scan you, and it will actually superimpose and measure whether the recession is stable or getting worse. At our initial visit, which is an hour and a half, we take photos of all the teeth, and we take photos of any recession, so we can go back and compare it to a photo. The times when I will refer to a periodontist for surgery, which is called a connective tissue graft or some other kind of free gingival graft, I won't go into too many gory details, is when there's not enough attached gingiva. So I mentioned thick biotype. That's where your gum is really thick. If you do get recession on a thick gum, it doesn't progress very easily. But if you've got a thin biotype to start, and somewhere near, like on the lower front tooth, if you pull your lip, there's a little string called a frenum. If when you pull on that starts pulling the gum away from the tooth, and there's no attached gingiva, which is the firmer pink gingiva. If you've just got this sort of thin reddish gum that pulls away, that is a definite sign that your dentist needs to refer you to a periodontist for a graft there, because those can get very bad very quickly.
All right. And Dr. Yudelman, how often should you have professional monitoring?
So usually if you're coming every 6 months, that should be enough after a good initial exam. People grind their teeth and they've got a lot of abfractions, which is a sort of a deeper notch on random teeth. Then a bite plate would work well. We've done a whole series on bruxism and headaches and TMJ and so on. So you can go back and listen to that when we would use that. If snoring is an issue and there's sleep apnea, then a sleep study and a mandibular advancement device, because a lot of people will clench or grind their teeth when they're sleeping, and that will cause those recessions and abfractions. We can monitor you regularly. Your dentist might not know much about sleep apnea. Depends on their training. They might just make you a bite plate, and that can make your sleep apnea worse. So if you snore, then it's time to get a sleep study and to make sure that if you have a dentist that they know about snoring and sleep apnea, your dentist should be able to help you keep optimal gum health long term.
And finally, Dr. Yudelman, what are the top 3 daily habits to protect your gum margins?
Yeah, floss gently once a day. I recommend flossing before bed so you don't go to bed with any biltong or popcorn or anything stuck between your teeth. That's when it's going to be the most effective. You have to be gentle. I've seen patients cause recession from overzealous flossing. They cause a little cleft. Using a very soft, high-quality electric toothbrush on the gentle setting and changing the bristles regularly. And then using one of those special toothpastes if there is inflammation. Your dentist will tell you more about it. I wouldn't just recommend ordering it online randomly. And then a bonus tip is to stop when you're brushing every so often and just look at your gum line, look where the bristles are going, make sure you're not overdoing things.
Some really good advice there from you, Dr. Yudelman, and that concludes another podcast, another edition of Save Your Money, Save Your Teeth. A massive thanks to you once again, Dr. Yudelman, for sharing your expertise with us. We appreciate it so much.
Thank you. I hope it helped just a few people to save some money and to save their teeth, or at least in this case, to save their gums.
Gums, yeah, exactly. Yes, thank you so much also to our listeners for tuning in. And remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.